Okay, ladies, it's time to discuss something very important that every woman should be in the know about: cervical cancer. Now, we've come a long way with testing and screenings, but there is so much that we as women need to know. So back with us to share all the important info is Dr. Jessica Shepard. Hey.
Hey, Dr. Shepard.
Happy New Year, everybody.
Happy New Year.
Now let's jump right into this, Dr. Shepard, with screenings. What are the best types when it comes to testing for cervical cancer?
Now, you alluded to it earlier about the Pap test, and that's what we've known for years that really works for cervical cancer screening. But when we talk about screening, that really should include the Pap+HPV test. Now, these two tests are complementary, meaning they're done at the same time. Now, the importance of the HPV test is that is going to detect the presence of the virus, human papillomavirus. Why is that so important? Because it is the leading cause of cervical cancer.
Wow.
Okay, so when we, normally go for our PAPs, you're saying that that's standard. But there's a new concept, and it's called cotesting. Talk to us about that.
Yeah, and cotesting has actually been widely adopted across the US, but many women don't know that one, it's being done, or to ask for it. So this is where the education comes in of going to your doctor and asking for the Pap plus HPV test together. That's what makes it the co-testing. And that is a preferred method because you get better results and better detection of possible precancerous cells.
Wow, that's good to know.
Now, we know that cervical cancer is treatable, but is it also preventable?
Yes, and if this is not the key messaging for today, is that cervical cancer is preventable. And that's why the Pap test is so important. So it's routine screening. You're able to go get this at your annual well woman visit, but that's because we're able to screen and detect if there's abnormal cells and if it's progressing to cancer. And then we're able to prevent it.
Doctor, at what age should we begin testing or screenings?
Now, this is a popular question I get because a long time ago, there were changing guidelines, but what we really do is starting at the age of 21 is when you should start your cervical cancer screening with the Pap test. Now, that breaks up a little between 21 and 29 when you're just going to go for your recommended Pap test. Now, starting at the age of 30, that's really when you're going to add that HPV test with the co-testing, like we mentioned before. So you want to make sure at the age of 30, going into your doctor for your annual well woman visit and say, I need co-testing.
Are there any symptoms or signs we should be looking out for on top of getting regular testing?
Now, the tricky part about cervical cancer is it not like it presents with typical symptoms. And that's why it's still so important to annually go for your visit, because we're able to detect that from the swab and we're able to see it under the microscope or with actual pathologists when they're looking at the cells. So again, it's not like it's going to present with a symptom. And if it does, that's usually late stage cancer. So we want to be able to catch it when it's early or prevent it.
What is your advice to people who don't feel comfortable about going to the doctor for their routine screenings at this moment because of the COVID concerns?
Yeah, I love that question because we have seen a decrease in the numbers that are going to the office because of COVID. So what are the best recommendations? The best recommendation that I can give as a gynecologist, and I would give my patients, is to make sure you go through with your results with your doctor, because there are some times where it is paramount that we see you again, and we will make every effort to make sure that you're safe as far as from COVID and social distancing. Now, there are instances in where if it's a normal or negative Pap test, as far as results, that we may be able to prolong that visit. But if there's something there that needs to be paid attention to, we've got to get you to the office, and we'll make sure that we do that in a safe way.
Yeah.
Doctor, there unfortunately are disparities when it comes to cervical cancer. Black women are twice as likely to die from cervical cancer as white women, and Hispanic women are 30% more likely to die from cervical cancer than white women. Where do these disparities come from, and what are the solutions to fixing them?
Now, the disparities, when we think of healthcare disparities, always span such a bigger picture than that, right? We know that there are disparities across all pillars in the US. So when we think of those statistics with cervical cancer, it means that we have to increase the access to Black and Hispanic patients, making sure that they have better resources, but also with education and making sure that we help women understand that one, we want to get you to your annual well woman visit, why it's so important for that Pap and HPV test, and the follow-up. The follow-up is critical.
Yeah, that's why it's so important for us to have these conversations.
Yeah, I love that
here
we did that.
And bring awareness.
Yeah.
Well, you have once again teamed up with Hologic to bring attention to these issues, which is exactly what we need. What exactly is your plan of action moving forward?
The plan of action is to make sure that we help women understand that no woman really should die of cervical cancer. If there's
Yeah.
anything that we want women to know, is that. And we've made significant progress when we think about the fight against cervical cancer, but we still have women dying from this. And we want to make sure that we're committed to helping women get their screening and prevent any unnecessary disease.
The earlier, the better.
Absolutely.
And raising awareness, having these conversations,
Yeah.
giving people the information
No
that you've just
excuse.
shared with us today.
Yeah.
So important. Dr. Shepherd, thank you so much for having this conversation.
you.
For more information on Hologic, just head on over to thereal.com.